Hey everybody, I'm Jay. This is Astrogator. This is my personal channel. I don't know why I'm blue, but anyway. I was at Philly Trans Health Conference and went to last month, and I went to a really amazing session on lower surgery. And I'm going to be talking about that so that I at least can give people a taste of what I heard. I can't really actually do the workshop for obvious reasons. And I'm going to be kind of vague about, well, they did a show and tell, basically. And you could imagine what that might be. And I'm going to be pretty vague about that whole thing, because I wouldn't never want to, these are guys that showed their surgery results. And I'm going to be respectful of that. Okay. Anyway, I'm going to do some warnings up front. First of all, I'm going to be very direct. I'm going to talk about body parts. And I am going to use the actual anatomic medical names for things. So, versus like the little FTM kind of code we have. While I respect the FTM code, I think it's just not necessarily clear enough for this kind of discussion, so I'm not going to be doing it. Anyway, needless to say, this is all not safe for work. Don't watch it at work. So anyway, there are going to be 3 parts for this. This is my part 1, which will be myths, and I'm going to go through like definitions, nomenclature, that sort of thing. My second one is going to be on metoidioplasty, and my third one, well, I'm not sure I'm going to do a third one. The reason is that it would be phalloplasty, but I'm not real confident in my information. I might do a very short one, just talking a little bit about it, what I know. Anyway. And I'm doing the video for a few reasons. For one thing, my own personal feelings have changed. I'm not going to really get into that in this video. This is going to be more of a general, like, this is what these things all are and so on. Another reason is I think there's somewhat of a lack of information out there. And this is going to be like a general, not like my specific procedure, but a general discussion. So I think that's kind of needed. And another thing is there are a lot of myths out there, which I'm going to talk about right now. First of all, the first myth is that very few people are satisfied with their results. I'm sorry, that was I couldn't find the page I was looking at here. So, well, obviously this isn't really true. In fact, even people who have like mixed feelings about their results, or they didn't like this aspect, they like that aspect. So, the idea of dissatisfaction would mean that you are totally not happy with everything, and that's not the case. 2, you lose sensation. Not true. Certainly for metoidioplasty, it just really is not at all the case. And in phallo, some people do lose some sensation, but let's compare it to top surgery. In top surgery, you don't have nipple sensation. So, is this a good trade? I feel that it was, but, not everybody. Pretty much people are happy if they've gone to that stage. In some cases, it's not even true at all, even in phallo. So, I would classify that as a myth. The results look bad. Well, let's compare with top surgery again. A lot of times, if you look at somebody who's had 1 month after top surgery or 3 weeks after top surgery. They don't look all that great. And I think the thing with lower surgery is there's a lot of swelling, and you're just not going to look that good right afterwards. So you should look at the results later. Otherwise, it's very it's very hard to figure out, you know. Lower surgery is extremely risky. There are various procedures that carry more risk, but like surgery is this risky anyway. It carries risk, but to think of it as particularly risky, I think that's not true. Another one is that all trans guys either want surgery or don't want it. Obviously, not the case. But not everybody understands that. Another thing, I think I want to call on other trans guys to stop using terms like, Franken penis and, things like that are very deprecating of somebody's genitals. Maybe you don't like it, but the person does like it themselves. I think we need to talk about people's bodies in a respectful sort of way. Okay. Anyway, well, now I'm going to go into some definitions. And I'm just going to not very much go into these, but just what these are. Hysterectomy is the removal of the uterus. If they do a complete hysterectomy or hysterectomy with oophorectomy, they also take the ovaries, and I don't know if all the cases they take the fallopian tubes, but in some cases they do. You need to ask for what you want specifically so that you're not like surprised later. Like you think that they've done something and they haven't done it. Phalloplasty is the use of a skin graft somewhere else. It's usually lower forearm, or forearm I should say, lower leg, groin, here. I don't know what you call that, but anyway. And there are various ways to do that one. And they take the graft and then they create the phallus and attach it. Toidioplasty is the use of the enlarged clitoris from testosterone, and they use what's there they release it from surrounding tissues, and they may use other tissues to give it girth, and sometimes not. Sometimes, if that's all that's done in a surgery, it's called a simple release. Anyway. Centurion is where they actually do add other tissues to add girth. It doesn't really actually add length. As far as I know, the only person who does this is Dr. Raphael in Texas, and it may be his associates as well. Urethral lengthening. This is where they use other tissue, for example, the inside of the lip, the mouth, the vaginal mucosa or whatever, and they create a lengthen the urethra so the person can stand to pee. If this is done with a metoidioplasty, it's sometimes called a ring metoidioplasty. I don't know why, actually. But anyway, that's the case. Vaginectomy, that's where they... now, actually, the procedure they use with trans guys is not a complete vaginectomy. They take the mucosa, vaginal mucosa, and they compress the area, and then they suture it. The Amans resection, well, they take the fat off the pubic area. The reason for that is so when you look down, your phallus is in a more normal position. You can see it when you look down and that kind of thing. Scrotoplasty. This is the creation of a scrotum from the labium major. It's not always done the exact same way. But there are various, I guess, degrees of it or amounts of how complete it is. It is also often done with testicular implants, which are silicone balls, basically. And sometimes, but not always, the skin is made, they use skin expanders to make the skin bigger so that they have more room for this. I don't know if this is done as much anymore, but I don't know. Anyway, well, thanks very much for watching. Take a look at me on It's a Man's World, FTM1, or, you know, you can, I'll have another video on this one. So, thanks for watching.